Good morning. It is Wednesday, the 19th of August. My name is Chris Paul, and this is Wellness Wednesday on behalf of the Intuitive Wellness Spa in Gambrills, Maryland. Welcome. Hope that you're all doing well and finding your way back to some semblance of normalcy during this somewhat crazy, if not at least unique time that is 2020. In today's Wellness Wednesday, I wanted to take a few minutes, and I'm going to probably do this over some additional sessions to talk a little bit about the different techniques that we offer in massage therapy. I find that most people come in with very little understanding of what they actually want from their massage therapist, and so we get requests often for deep tissue massage. And when you start to give that to someone, I'm going to say more than half the time people are not liking it. It's far too much pressure for them and it hurts. And so I thought maybe if we enlightened a little bit about the different styles, it would be helpful for people to understand. So I'm going to talk a little bit about deep tissue and why you would want a deep tissue massage versus why you would potentially not want a deep tissue massage. As the name implies, this is very deep work. So if you're used to a massage where your therapist is sort of gliding over the surface of your body, not without any pressure, but these long, rather rapid for the most part, strokes, deep tissue is not like that. The deeper you are going, the slower you have to go. Otherwise, it's excruciatingly painful. And the intention of deep tissue massage is to be compressing that muscle as much to the bone as the person can allow. We're really trying to get to those bottom layers of muscle fibers and muscle tissue to really bring extra blood flow into that area, to really bring out toxins that may be developing in that area, and to really help promote healing. And so, for the person who's having what I would call average stress, a little bit of sore neck from too much time on the computer, maybe too much time on their phone, and are not really suffering any sort of genuine injury, that level of pressure tends to be fairly unpleasant. And since most folks are coming in sort of thinking, yes, I have these aches and pains and I'd like them to be addressed, but I also want to feel good and I want to feel relaxed, then you're really more in the Swedish form of massage. And not that you don't use Swedish techniques in deep tissue, but Swedish is more of those full long strokes that are going to be more at a light touch for some folks to even a medium if you really want to feel something. Your regular massage, I use the expression of kind of a hurt so good. So you want to feel it so that you know that something is happening and that we're getting, we are improving that blood flow, but it should not be very uncomfortable or even painful. It is not uncommon, however, for deep tissue to be a little on the painful side. It is really used to treat chronic pain and muscle or and sports related injuries. So it's really designed to really get down and um, create a healing effect. Swedish is really more of a relaxation technique, and it's going to help with that tension from everyday activities. So, either way, you might notice your therapist using fingertips, knuckles, thumbs, palms, forearms, elbows. All of that is involved in either stroke. It's just really a question of pressure. So, again, with deep tissue, we want to get really down into those lower levels. So it's going to feel like a lot of press and hold because we're going to need you to catch your breath and be able to breathe through this. Breathing promotes that circulation. So there's this compression. And then it's not that once we go in, we just come right back out. You might move. There will be some form of gliding, but it's very, very slow. So, what are some of the side effects? Well, it is not uncommon in deep tissue massage if you bruise easily that you'll find there's bruising. It is not uncommon for someone to get a truly deep tissue massage and feel sore for 2, maybe even 3 days afterwards. It's not uncommon and shouldn't be a panic. You can apply a moist heat or even an ice pack wrapped in a towel to kind of help with that because we want to do keep the blood flow moving. So we want to not let any inflammation build up, but it isn't uncommon for it to happen that way. And you'll see that too in physical therapy. A lot of times people get massage when they go to PT, And that tends to be deeper work because, again, it's really focused more on that rehab. And they'll tell you the same thing, or sometimes you'll see it at a physical therapy location where they'll apply moist heat or they'll apply a cold pack to just sort of help with that. It isn't a great technique if you have a history of blood clots or if you're taking blood thinners, you're going to bruise in those cases. And if you have a history of blood clots, we could do some actual damage. And if you are undergoing cancer treatment like chemotherapy or radiation, this is probably, deep tissue is probably going to be something that you're going to want to um, not do, at least not until your doctor says that it's okay. And of course, we're not going to do anything like this if you have an open wound. So, what about those of you who are thinking, well, but I don't want to just have something glidey. I really want to feel the work. That's not the definition of deep tissue. That's still a Swedish massage. I can certainly go in to a client who really just has regular, we'll call it, muscle tension and apply some really firm pressure to help get in there and start breaking up some of that tension and bringing blood flow in. And there's a multitude of other techniques with stretching techniques and some specialties that I'm not going to get into today that can also help in those areas. But when you ask for deep tissue, know that what you're asking for is that really deep compression where you're going to feel like we're trying to get to your bones. And in the grand scheme of things, it's not going to be something you're going to be able to fall asleep during. You're going to have to be doing a lot of focusing on your breathing, but it is incredibly therapeutic if you have injury or chronic pain. So I just want you to kind of know what you're asking for, especially if you're new to massage, because your therapist may not know you and may come in expecting that you do know what you want, getting in there and doing some deep tissue and really creating an environment for you that is less than pleasant. As always, if you are not happy with the level of pressure that you are getting in your massage, you should speak up. A quality therapist is going to check in a few times, but we don't want to ask you every 2 to 3 minutes. So feel free to say, you know what, that's too much for me. This idea that massage has to hurt to be successful is also false. Deep tissue has a very specific focus, but improving your circulation and in helping your body to relax has countless benefits. So don't feel like the massage has to hurt to feel good later. Don't feel like it has to hurt to be effective. You can have a quality Swedish massage that is just improving circulation and helping you to relax, and the effects of that on your muscles are going to be great. So this idea that there has to be a no pain no gain mentality is crazy. And if you get a massage therapist, and some of the newer massage therapists I think get into this mind themselves that they really have to dig in there and go for it, who tries to convince you, well, you've got this and I just want to get that out for you. It's okay for you to advocate and say, you know what, that's just not what I'm here for today. I just really, I'm okay with you working, firmly, but I'm not looking for deep tissue. And that's okay as well. And to all the younger therapists or even the experienced therapists who also have that sort of no pain, no gain attitude, I'd caution you to take a step back and really remember, especially in the climate of the world we live in, how valuable taking time for someone to just relax and do deep breathing and improve their circulation, what the actual health effects of that are. Now, if you are in the area and you're looking to come into Intuitive, we welcome you. We do offer deep tissue, and I would highly recommend that you see Chelsea. Chelsea, I do deep tissue by all means, and you're welcome to book with me or any of our other therapists. But at the moment, I would consider Chelsea to be our best deep tissue therapist. And so I would highly encourage you to schedule something with her. So I thank you for joining me and taking time out of your day to watch this. I hope you'll tune in again next week. In the meantime, be well.